It's my pleasure to introduce our keynote speaker this morning, Lynne Livingstone. She didn't want me to go into a lot of detail because she has other things, so just really quickly, for those who may not know, she's the Managing Director of Neighborhood Children and Fire Services. She's here today to talk to us about the role of Chair of London's Child and Youth Network and the Family-Centered Service System Priority. Welcome, Lynne.
Well, good morning, everyone, and thank you, Paul, for the introduction. I actually was really appreciative of where Paul started this morning with the few kind of comments about family, because that's where we started as a community 8 years ago, when we first started talking about the Child and Youth Network. So it's my pleasure, great pleasure to be here this morning, and I'm very excited to see so many of you in the room. I know you have all been working hard together on trying to improve outcomes for children, youth, and families in our community, and many of you are involved in multiple initiatives, that all connect around our family-centered service system. So whether you're working on a family center in a neighborhood, whether you're also working on our special needs strategy or mental health transformation, all those pieces are trying to come together in our community to do good things for families. What I'd like to do this morning is tell a story, if you will. So where did we start? Why was this important? Why did we decide to do it? And what are the results trying to show? It's a little bit about what Paul started us with in terms of, here's what families said, implementation science, and I'm embarrassed to admit I'd not known that term, but I now love it and will use it in terms of making something happen, and then the accountability around results. So that's a very nice frame for what I'm wanting to share with you this morning. So many of you will know that in 2007 we came together as a community because we wanted to improve outcomes for children, youth, and families. And we came from very different, and you see them in the room today, very different sectors, whether we were with social services or health or education or recreation, libraries, you name it. People are interested in trying to do good things for families in our community. And we were held together by our shared vision of happy, healthy children and youth today, caring, creative, responsible adults tomorrow. And way back then we said, well, what do we want to do to try and make things better for families in our community? And the first place we started was trying to understand what issues families were facing in our community. We knew at that time that many children were doing well in our community, but we also knew that there were a number that faced barriers or issues that maybe we could do a better job of trying to address collectively. So we learned some things. We undertook to learn some things, and we learned in London in 2007 that 1 in 4 children were coming to grade 1 not ready to be successful. We learned that 1 in 4 children were obese or overweight. We learned that 1 in 5 children in our community would live in poverty at some point in their lifetime. Those were some of the compelling things that we learned about the experiences of children and families in our community that galvanized us to try and do better on those fronts. But we also undertook to talk to families at that time. We actually said, what do you think of our vision statement? And what families said was, that's great, but we want you to do something. And then they took the opportunity in 2007 and 8 to tell us about our service system. And they told us at that time that it was too hard to access services. They told us that it was too hard to navigate the system once they could figure out where to access services. They told us that they had to tell their stories too many times, that they had to go all over our community to access services, and that it takes too long to receive services. So I think that had a big impact on us in 2007, because when we set our agenda, we said we're going to deal with those issues around poverty, literacy, and healthy eating, but we're also going to undertake to do something about our service system, because that kind of experience isn't acceptable. And in 2007 and 2008, we took what probably seem like small steps now. We did referral maps. We had actually really important conversations back then about community hubs. Michael led those discussions for us. We undertook to understand how we might actually want to work with families and neighborhoods differently. That was the beginning of our discussion around community development, which is such an ingrained part of how we work today. Those were the things we started back in 2007 and 2008. And what I think that did for us as a community is we started to actually work together around our service system as a community, so that in 2010, when Charles Pascal, who was the special advisor to the Premier at that time, released his report, Our Best Future in Mind, we were ready for what that report challenged us as a community to think about. In 2010, there was that map of what services looked like provincially. So we said, well, surely London can't be as bad. Our map will look better. And we tried to map our services. And guess what we learned? We weren't a whole lot different than what the province's map looked like. And so I think what that did for us as a community was really galvanize us to be bolder, to think better and deeper about how we could maybe change our service system. Yes, we did take an important small steps forward, but this really pushed us to think differently back in 2010. So what did that thinking differently actually wind up looking like? It looked like this vision statement, and I'm just going to read it to you, and because there's important elements of it to unpack a bit. So our vision statement back in 2010 was that in every London neighborhood, residents will open a single door to multiple opportunities that support children and families in achieving their full potential. The opportunities will be identified by the neighborhood and will be implemented according to evidence-informed practices using integrative, inclusive, and holistic approach. Really important concepts in that definition around a point of access within a neighborhood, defined by the neighborhood, informed by evidence, but building on an integrative, inclusive, holistic approach. And that's what we've been trying to deliver on since we created that back in 2010. And we said that in order to do that, in order to achieve that bold vision, we needed to implement at multiple levels. We needed to implement at a system level. We needed to change our service system so that it would be truly family-centered. And we needed to implement at a neighborhood level something that we wound up calling family centers. And that what we were trying to do was move us on that continuum past collaboration and coordination to truly an integrated service delivery system. And that our vision was that we would do that by creating a system that was family-centered, but also having a network of family centers across our community. And in our family centers, and you'll be very familiar with that diagram, but what we were trying to do was create an identifiable destination within a neighborhood that had a set of core services that was intentionally connected to specialized services and supports, the pieces around the center, and that the look, feel, and delivery would reflect the uniqueness of each and every neighborhood. That we would have consistency across our system, but the family centers would be generated based on the engagement with the neighborhood. And that's what we've been working towards since 2010. We said we needed to press a lot of levers at the same time to make that happen at a system level and at a neighborhood level. That we needed to develop a definition of our common experiences. What do all those core functions look like consistently in every family center? That we needed to understand exactly how we were going to engage our neighborhoods in a meaningful way so that truly the centers were neighborhood driven. That we needed to look at our funding and sustainability. That we needed to create something called interprofessional community of practice, of which I know all of you live every day. But what that was about back then was the idea of understanding the role and function of each person trying to support a family and how we would work together to be able to do that. New conversation for us, different kind of conversation for us. We needed to put the policies and protocols in place to support the kind of governance work we're doing together. So we pressed lots of those levers all at the same time, again at a system level and at a neighborhood level. There were some core beliefs that drove what we were trying to say around what we hoped to achieve by moving forward with a family-centered service system. And the first one is quite important. We came from a place that said the services or functions that you deliver every day we're going to assume that you're achieving good outcomes for children and families. You're doing the evidence work on that. What we were trying to do as a system was create access to that to be easier and better, so that families' outcomes actually could be improved because of the improved access and experience they were having. And we believed that through our system change, we would be able to improve outcomes. We also believed that transformative change required thinking and acting differently on multiple levels, which I know you've lived through how we've moved forward with the implementation of this strategy. We said that if we did all that and held true to what we were trying to achieve, that we would be able to deliver on these kinds of outcomes. So what we were trying to achieve is that families were connected and engaged in their neighborhood, that their experiences were reduced storytelling, that they would have a better and more consistent experience in accessing services, that they would be able to access easily a full range of services, and that they would have shorter wait times. That's what we've been working on. That's what we've been trying to achieve. On that point about accountability and living what you say or living what you can do, we undertook an assessment. We wanted to understand, with all this work, and I know many of you in the room and many who aren't here have worked incredibly hard to deliver on this vision, because we believed in what that we were in the right direction, but we needed evidence. So we undertook a third-party assessment to be able to understand, are we having the impact that we believe we're trying to achieve for families? We had a wonderful opportunity. London, and I know you've heard me say this before, we were recognized 3 years in a row as something called a community integration leader. No other community in Ontario has been recognized that way. With that recognition, which is always nice, but with it, more importantly, came funds to undertake some of the work, like our interprofessional community of practice, but it also came funds to undertake research so that we could actually understand the impact that we've been having or trying to achieve in our community. They also, the province, in addition to, because they never give without asking for something, they wanted us to help in terms of a development of an evaluation framework for these kinds of experiences that would help inform early years policy across the province. So the purpose of the assessment was to determine how the approach has impacted families' experiences in accessing services. It was to assess what those experiences were for families in the family centers. It was also to investigate the changes across the system. So we wanted to understand the impact for families, the impact around the family centers, but also systemically from an organizational perspective. And finally, our findings, as I said, were meant to help inform where the province is going from a policy perspective. So we wanted to make sure that this was going to be good. We wanted to make sure that it was done well. We engaged a third-party organization, Maltest and Associates. This is an organization that has deep experience and resources in doing this kind of work. We asked them to make sure that the assessment would be robust, that it had mixed methodology, that it would be statistically significant, multi-level, that it would be inclusive and participatory, use multiple lines of evidence. All those were very important to us. They did side-by-side comparisons, as many of you will know, between family center neighborhoods and those that did not yet have a family center, so that we could truly do our best to understand the impact that we were having. What's important to understand is that it is a point in time, though. So it is, but it would allow us to understand whether we were on the right path. So the approach, as I've said, was to look at a system level of the impact, but also what was the impact at the neighborhood level. And the good news is, so here's the good news, and then I'll share with you the details, is that the evidence from this assessment is demonstrating the following. So think about those 5 outcomes that we said we wanted to try and make a difference on. We're seeing evidence to say that families are, because of this work and this approach, connected and engaged. We're seeing a beginning of reduced storytelling, that there is a better and more consistent experience. They have easier access to a full range of services, and they experience short wait times. This is tremendous news. The assessment was done within the first year of full implementation of 2 of our family centers. Imagine what those results would say today, knowing the impact we had in the early days. So let's unpack it a bit. What we learned is at the neighborhood level, so the orange are families who visited a family center. The gray are those that were in a neighborhood without a family center. So what was their experience in that neighborhood? So you can see vast differences on all fronts. Feeling more comfortable, much more informed, much easier experience. So when you think about the things we were trying to deliver on, huge difference by taking a family-centered approach. We also learned, again in the side-by-side comparison, that in terms of being provided more information about programs, finding out about additional services, being connected with other staff, and having follow-up on all those indicators, again, a vast difference, much better experience for families through a family center, through our family-centered approach. The data is powerful, but what also is so important is hearing directly from families, and I just want to read the quote on the right. We previously had a hard time finding what was needed in London, but accessing services from family centers was easy. It was also free of cost and close to home. So not only were we making a difference from a data perspective, you can't argue how impactful and frankly impressive those differences are, but in hearing the voice of families, they're telling us this is a better way. So what does that actually say to us? Well, it starts to pile up a bit. So what we're seeing is by having Community Connector, and we heard a lot about the importance of that function in our family centers, plus a wide range of access to a wide range of services, being in a single identifiable location is equaling an improved experience for families. And what the evidence has said to us at that point in time, we are on the right path. There is very strong evidence to say that families have a better and more consistent experience at the neighborhood level, and that they can access a full range of services. There's some evidence to say, and remember this was a point in time, that there's reduced storytelling, shorter wait times, and they're better connected in their neighborhoods. So all of this is saying we are on the right path from a family experience perspective in a neighborhood level. What does it tell us at the system? So this is understanding the impact that organizations feel is happening because of this work. And so what we're hearing from organizations, or what we heard through the impact assessment, is that people never really knew what our organization did in the past. As a result of the family-centered service system, organizations now understand the depth and range of programs and services we offer to families. So not only starting to hear that we're actually making a profound difference at the family level, neighborhood level, but also at an organizational level. So what does that actually look like? So from a cultural perspective, what we learned through the assessment is that 74% of organizations said that by working in a family-centered service system way, it has changed the way we work together moderately or significantly. 71% said, and this is, I find so interesting, 71% said that it's changed the way families access services moderately or significantly. Families actually told us a better number than that. So we're very hard on ourselves. What we also learned is that 76% of organizations said that it's changed the way their own organization provides services. By working this way, we are changing either moderately or significantly. So you may remember years ago we did an integration survey and we had to say where we were on the continuum from awareness to full integration. And one of the things we learned in that survey is that there was a disconnect between our belief of the system and what we were actually trying to see. And I think what this is showing us is that we're now moving closer in terms of that connection between belief and reality. What the impact assessment also told us at a system level is that through greater awareness of what service providers' capabilities and delivery options are, is that leads to new partnerships. So that seems obvious, right? But what it also has done, and this is the connection to our desire around reduced storytelling, reduced weights, is that organizations are now saying to us that because we're more aware and we have more partnerships, our referrals, so referrals sent by my organization to other organizations, are more accurate, that my staff have a much better understanding of where to refer, and that when I get referrals, they're more appropriate and more accurate. So at a system level, we're starting to also see that pile up of things coming together to have an impact. So through increased awareness, we're seeing greater collaboration and new partnerships. Through the great work that you folks do at the neighborhood level, in terms of the neighborhood level planning, along with informed sharing, we're seeing easier access to services and information for families, new programs because we can be more nimble and responsive, and finally the last piece, greater program reach. The impact of what you do. So if you go back to that core belief that we believe that your outcomes are doing, that what your programs do is achieve good outcomes for families, by having greater program reach, we're going to impact on more families that way. So at a system level, what we're seeing is, just to recap, improved information sharing, increased referrals that are accurate and wouldn't have been made before, less duplication between organizations, and a much more comprehensive wraparound set of services for families. So what the impact assessment has said to us is, at a family and neighborhood level, we are on the right track, and at a system level, we are on the right track. We are making significant differences in both those areas. This is fantastic news. So where do we go next? I think we should celebrate how fantastic this is. I don't know how to articulate what position this does for us as a community. Not only is it rewarding to understand that we're on the right path and we're making a meaningful, statistically significant difference for families and for each other, but we are also should feel excited about when others look in, we're able to demonstrate that it's working. And what that means for us is it opens up the possibilities of where we can go next. So what we're doing at a system level is we're continuing to work together at our governance table and make sure that's strong and know that we're doing the right thing and moving in the right direction. We've put in place, through the leadership of Child Reach, the Community Connector System Coordinator, so that that critical function is consistent across our system. The good work around interprofessional community of practice continues to deepen as we understand what each other does and work well around our families. We heard that we need to strengthen our awareness in the neighborhoods around our family centers, so putting concerted effort into that. And then the ongoing work around, and it will always be, seeking that stable financial model as we continue to move forward. So we're continuing to build our network. Both of our family centers, remember that vision. We wanted to see a family center in every neighborhood. We've begun with 4. And we're going to continue to move forward on that path. But it isn't just the network of family centers, it's also that family-centered service system and strengthening that and making sure it's good across our entire community. So we've had some exciting new developments. And I think as a community you should feel really pleased about this. So you know that the province has been talking a lot about community hubs, and we have been working very hard with our partners in the school boards to try and influence the Ministry of Education and other ministries on how they fund things like family centers. So in order to move forward with the first 4, this was municipal investment. But because of our work and our good work with London District Catholic School Board and the Thames Valley Board, we've been able to demonstrate that not only is this an important investment for our municipality, for all of you who put in-kind resources or financial resources into this, we've been able to demonstrate to the province that they should put funding on the table. So the impact of the decision to support the opportunity of a family center in St. Francis Catholic School is tremendous. What that announcement has said is that the Ministry of Education is willing to put education capital dollars into a community to support something like a family center. I can't tell you how significant this is. Yeah, it's that. It's opening the wedge, right? Our foot's in the door now. So, because we've been able to demonstrate this is a good thing for families. And by making our investment and showing our leadership, the province is now willing to come to the table. So they're not paying for the whole thing, but they're putting significant dollars, and you would have seen that announcement a week or so ago. The other great opportunity that we have, and for those of you that don't know where St. Francis is, that's in the Westminster neighborhood. The other great news is that the Thames Valley School Board in their capital plan received approval around 88 new childcare spaces, which is an important piece of what we're trying to do in our system. Now, they didn't put money on the table yet, but what they've held the door open on is the possibility of building family centers in those locations as well. So we've gone from working very hard to get 4, they're up, they're thriving, they're successful, we can demonstrate the impact. We're now beginning to see a path forward on where we go next, trying to achieve that vision of 42 across our community. Maybe Ian always says if we do 10 or 15, that'll be a good day's work. So that's what we're working towards, to try and create that network. So this presents opportunity for us on where we go next. But we are having important conversations right now at the governance table about exactly that. Where do we go next, and how do we do it? We have an opportunity with St. Francis in front of us. To me, that's a no-brainer. There's money there. There's opportunity there. We have a potential opportunity with the 2 new schools. So this is an important conversation that the governance table is having on how we move forward. When we started way back, we said we wanted one family center in every neighborhood. We created a set of criteria to understand where to start. And that looked at low income, it looked at child population, it looked at EDI results, and put our neighborhoods in an order to give us a sense of where to begin. So we're looking at that again to say, is that the right order, knowing where to go next, or do we build on opportunity? The other thing that we are looking at is how do we think about lead agencies? When we started this work 4 years ago, we asked people to self-identify. If you were interested in being a lead agency, put your hand up. And that was wonderful. We have wonderful lead agencies, and I'm tremendously grateful for their willingness to kind of take a risk and do a lot of work to move us forward as a community. And so the question is that the process we want to follow for the next ones? And so that's also a conversation that governance is having, the governance table is having. So if you are leaders of your organization who sit at that table, haven't been there lately, you might want to suggest to them that now would be the time to come back and participate actively, as these are critical conversations, very time-sensitive conversations that we're having right now. So what we would like, my ask of you today is to share the good news about your work. This is the meaningful impact that we're having for families in our community. Your hard work is paying off, and everybody should know about it. I would ask that you take advantage of the opportunity to continue to learn from each other. That's what's going to happen today, but also to continue to learn from families. That's why we've been doing it. That's who we are about, and they're such an integral part of where we're trying to go. Share your knowledge and expertise. You are the people that are making this happen on the ground. And I'd ask that you take a moment to just reflect on the good news today. Sometimes we work so hard and get caught up in the busyness that we don't take a moment to celebrate. And I hope that you do that today, because we're doing a tremendous thing as a community, and you should feel good about it. And with that, I'll just say thank you. It's always my favorite thing. Of all the things I get to do in a day, talking about this and being with the people who work so hard to do good things for children, youth, and families in our community is my absolute favorite thing. So thank you for that.